Hello, my name is Kayla Chapman and I will be demoing your CVC central line dressing change checkoff. And so of course you are going to show your badge. So I have already reviewed my physician's order. I've gathered all my supplies needed and make sure they're all intact and not expired. So I'm going to then knock on the patient's door and, hello, my name is Kayla. I will be your nurse today. Can you tell me your name and date of birth? And I will provide privacy, do hand hygiene. Okay, thank you for confirming that. Are you able to verify any of your allergies? Okay, well, I'm here to do your central line dressing change. Are you okay with that? Patient says they're okay. They're aware of the procedure that we're going to be doing. So now I'm going to put my comfortable in a comfortable position. So I'm going to raise the bed. And your patient should at least be in a semi-Fowler's position while you're doing this dressing change. And I'm gonna absolutely let this side go down. I'm gonna raise the bed here a little bit higher. Okay. And so I'm gonna go ahead and don my gloves. And I'm going to now don the mask on my patient. And for checkoff purposes, I will not don on my mask so you guys will be able to clearly hear me. But as you're donning the mask on for your patient, you also want to make sure you are putting the mask on yourself. And I'm gonna go ahead and ask my patient to tilt his head away from the insertion site. Again, that's when I will be donning my mask. It does not matter if you guys put the mask on that is on top of your kit, on the patient or on yourself, vice versa. If it's in the kit, you put it on yourself or the patient. But the whole goal is to have a mask on yourself and the patient. So now I'm going to go ahead and expose the site by still maintaining modesty within my patient. And so as I take off this dressing, I am going to still be supporting the catheter because I do not want to dislodge it. And I'm just going to go in a circular motion. But I'm removing this transparent tape, this dressing, and I'm moving it towards the insertion site. And so as I am removing this transparent dressing, I'm gonna go ahead and get rid of it. And I'm also going to remove the securement device. So you will not have a securement device in your kit, but we do expect for you guys to acknowledge that there will be one in there. Same as I'm removing the dressing, you will be removing the bio patch or the gauze that you might have in place. So now I'm going to assess my patient's insertion site, and I'm checking for any drainage, redness, any swelling, or odor. So the drainage, the insertion site looks good, so I'm gonna go ahead and take off my gloves. I'm gonna provide hand hygiene. And I'm gonna prepare to set up my sterile field. So we know that the sterile gloves are always gonna go over here. And so the biggest thing with CVC is you wanna make sure that you're not turning your back on your sterile field. So what would really help you guys is if you kind of position your table slanted in a sideways position. And as we start that sterility process, I'll show you why. So I'm gonna open my kit, which is always gonna be away from me. and I'm going to remove my sterile items, and I'm gonna go ahead and get this out of my way. So I'm gonna just put this behind me. As you see, as I'm discarding this box, I could either throw it away in the trash can here, or as long as you are not turning your back on sterile fill to get rid of this. Okay, so I'm just gonna step aside and put it behind here. And then I like to go ahead and open my kit. If you prefer to put your sterile gloves on and then open your kit, that is also an option. But I'm gonna go ahead and open my sterile kit from within the 1-inch border. And so it's always gonna be away from me, the sides, and then towards me. And I'm gonna move it over here. So I have plenty of room to don my sterile gloves. I'm gonna come over here, and I'm gonna don my sterile gloves. And as I'm donning my sterile gloves, of course, I'm gonna always grab it and step back. And I'm still here with inside of the cuff. And pull this down, tap it. And stepping back. And so you can choose to get rid of this, you don't have to. So now I'm gonna prepare my sterile field, and I'm just gonna make it easier for me to be able to grab everything with one hand. So I know I need this gauze pad here, and I have my bio patch. If you do not have a bio patch, then you are able to use the split gauze. I have my skin prep, and so I'm just gonna pull this stick out. So again, it'll be easy for me to grab it with one hand. And if you have 3 swabs here for cleaning, I know that I'm only gonna need 2. And so I'm gonna pull the 2 sticks out. And I have my Tegaderm, my transparent dressing. It will be easier for you guys as soon as you start your checkoffs to already have your bio patch, if you're using one, and your Tegaderm dressing out of the package. So I'm gonna grab my gauze, and I'm gonna lay it on my lines here, and I'm gonna pick it up. So at no point do I want my sterile gloves to be touching the lines. So now I'm gonna start with my cleaning. I'm gonna grab one of my swabs, and you're always gonna start at your insertion site. And I'm gonna go in a zigzag motion, cleaning it, making sure I never come back to the insertion site because I've already cleaned it. And I'm gonna clean this for 30 seconds, at least 30 seconds. Okay, so that's one swab to clean the area. Then I'm gonna grab this other swab here, my second one, and I'm going to clean one swipe down the top of the line, and then I'm gonna be cleaning the bottom of the line with one swab, and that's it. Again, letting it air dry. Now, I am ready to apply my skin prep. My skin prep does not have to be applied on the line. So I'm gonna apply my skin prep here in a zigzag motion, and as you see, I'm still holding my line the entire time with my gauze. So again, I just applied my skin prep. I'm gonna let it air dry. Now I can go ahead and apply my bio patch here. And at this point, I can go ahead and let this gauze go. I'm gonna get rid of that. And I'm gonna verbalize and acknowledge that then I would be reapplying the securement device for my patient's central line. Now I'm gonna grab my Tegaderm dressing. And I'm only gonna verbalize that I'm going to date, time, and initial this dressing. And so I'm gonna make sure once I place this dressing down here, it's right over the bio patch, but is also covering all of the line. So I'm gonna apply this Tegaderm. Take this off here. I can then use this sticker that's on my Tegaderm dressing to date, time, and initial. Again, this is something that you guys would just have to verbalize. And of course, I'm never gonna put it anywhere near or on top of my insertion site. And so after that point, my sterility is done. So now I'm gonna go ahead and cover my patient back up. Make sure my patient is okay. I'm going to lower the bed. Provide my patient with the call light. Make sure they're comfortable, repositioned. I'm going to go ahead and get rid of my gloves and clean up my supplies. I'm gonna always make sure I do hand hygiene. And then I'm gonna mention documentation, which your documentation is the fact that you changed your patient's dressing with the date, time, and I'm gonna assess for or document any assessment of the insertion site and how the patient tolerated the procedure.